Good day, everyone. I'm John, your moderator for this webinar. I welcome everyone for today's webinar, which is called 2022-23 ICD-10 Coding Update and Home Health Hospice. So now I would like to introduce our presenter for today. She is my all-time favorite speaker from Home Health and Hospice. Her name is Sharon Litwin. Sharon Litwin is certified experienced ICD-10 coder who teaches coding and conduct agencies reviews. She has extensive experience in teaching home health and hospice topics. So now I would like to hand over the floor back to our speaker. Over to you, Sharon.
Thank you so much. Hi, everybody, and welcome today. We're going to go over the very numerous code revisions for our 2023 ICD-10. This is one of the most revisions since we went on to ICD-10. Gosh, how long is that now? 5 or 10 years? There's 1,176 new codes. 28 codes have revisions to their descriptors, and 251 are deleted. We do in circulatory, the I codes, have an addition of 43 new codes. The external causes an awful lot of electric bike injuries. There are so many codes, some we won't be using much or it'll be so infrequent. So these are the chapters. So the coding guidelines, the ones that are specific to the chapter, another coding guideline, the documentation of complications of care. Admitted for HIV-related condition, the principal diagnosis should be B20 HIV disease. 3, candidiasis of vulva and vagina. They added a subcategory for B3731. Chapter 2, neoplasms, C00 to D49. Okay, the chapter guidelines here, admission and counter for treatment of primary site, a secondary malignant neoplasm of lymphoid tissue. All right, chapter 3, disease of the blood and blood-forming organs and certain disorders involving the immune mechanism. That's the D chapter. So they expanded the subcategory for D59.3. That's the types of HUS, hemolytic uremia syndrome. Now they expanded greatly the subcategory D68.0, von Willebrand's disease. They changed D75.89 to D75.84, other platelet activating anti-PF4 disorders. D81.8, other combined immunodeficiencies. Chapter 4, endocrine, nutritional, and metabolic diseases, E chapter. So guidelines for the injectable non-insulin drugs. Expanded the subcategory for E34.3, short stature due to endocrine disorder. So you can see how specific they've gotten. I'm not going to read those to you because I don't think that'll be something we run into much, but of course you'll have to. Chapter 5, mental, behavioral, and neurodevelopmental disorders, F01 to F99. This is the big one. So then there's a new guideline for dementia categories F01, 02, and 03. We add severity levels. So the definitions in the coding guidelines are mild dementia, clearly evident functional impact on daily life. Vascular dementia, unspecified severity. So F01.51. This is revised from vascular dementia with behavioral disturbance. F01.518, vascular dementia, unspecified severity with other behavioral disturbance. Now we get to F01.53, vascular dementia, unspecified severity with mood disturbance. And now we're going to have a lot of A's in here. F01.A is vascular dementia mild. So now here's an example of moderate. F01C0, it's severe. Now, F02 is dementia in diseases classified elsewhere. And this is an example of that, so that you have a cheat sheet. And then F02A, F03.90, unspecified dementia. So mental and behavioral disorders due to psychoactive substance use. For the mood affective disorders, F43, they expanded the category reaction to severe stress and adjustment disorders. So Chapter 6, Diseases of the Nervous System, G00 to G99, Inflammatory Diseases of the Central Nervous System, Systemic Atrophies primarily affecting the CNS system, so G10, Huntington's code. Same with Parkinson's, G20, Alzheimer's, G30. Okay, G31.0, frontotemporal dementia. G31.8, other specified degenerative diseases of the nervous system. We have a lot of the little term differences. This is actually diseases of the myoneural junction and muscles. Sarcoglycan dysfunction. And here are more of the limb girdle muscular dystrophy. G90, disorders of autonomic nervous system. G93, other disorders of the brain. Ischemic heart diseases, I20 to 25. Now, these are all the types. Other forms of heart disease, I30 to I5A. I34.0, non-rheumatic mitral valve insufficiency. I47 for paroxysmal tachycardia. All right, so diseases of arterial arteries and capillaries, I70 to I79. And then they expanded the category I71, dissection of the aorta. Chapter 10, respiratory system, J00 to J99. Not a lot of change. Chapter 11, diseases of the digestive system, K00 to K95. Diseases of the liver, K70 to K77. Chapter 12, the skin and subcu, the L chapter. Chapter 13, musculoskeletal and connective tissue, M00 to M99. So M51, disorders of muscles, M60 to 63. M93, other osteochondropathies. M96.A, Chapter 14, diseases of the GU, genitourinary system, N00 to N99. So renal tubulointerstitial diseases, N10 to 16. Inflammatory diseases of the female pelvic organs, N70 to N77. 168 new endometriosis codes. And so you have N80.0, uterus, so other anatomic areas. So a chapter guideline for hemorrhage post-elective abortion. There are multiple additions to O35. Expanded the categories of P28.3 and P28.4. Chapter 17, congenital malformations, deformations and chromosomal abnormalities, Q00 to Q99. So they expanded malformations of the cardiac septa regions, expanded category of Q85, phacomatosis. All right, so this is our R chapter, R00 to R99, chapter 18. Signs, symptoms, abnormal clinical and lab findings, not elsewhere classified. Chapter 19, that's the huge chapter of S00 to T88, injury, poisoning, certain other consequences of external causes. A chapter guideline note. Okay, S00 to S09 is injuries to the head. Okay, so concussion has been expanded a lot. SO6.0, we have, code also if it's focal traumatic brain injury. Okay, chapter 20, this is where I couldn't find electric bike. First of all, motorcycle rider injury in a transport. All right, the Z chapter, yay. Chapter 21, Z00 to Z99, factors influencing health status and contact with health services. So the social determinant of health. So now they expanded category Z59.8 related to housing and economic circumstances. The subcategory Z79.6 and then chemotherapeutic, multiple additions of specific types. They expanded the subcategory Z87.7. Okay, this one we will be using Z91.A, caregivers' noncompliance with patients' medical treatment and regimen. So again, you code first the T36 to T50, the new underdosing guidelines. Now this is patients' noncompliance with dietary regimen, which falls under Z9111. So these were effective October 1st. So I want to really thank you for being with me today. So I hope that you enjoyed this and got some info from it. Thank you.
Thank you, ma'am. Thank you, participants. So with this, we conclude this session for today. Thank you so much for joining today's webinar. Have a great day, everyone. Thank you, Sharon. Thank you so much.
Thank you.